20 doctors gave up on the admiral's daughter. 3 hospitals. The same verdict every time: she will never hear again. But here's the question that should scare anyone who's ever trusted a diagnosis with their whole life. What if the problem wasn't that she was gone to sound, but that sound couldn't reach her yet? It's after midnight in Norfolk, Virginia. Fluorescent lights hum. Rain needles the windows. Discharge papers wait on the table like a final order. Admiral Grant Harlan stands rigid in dress blues while Lily sits in a wheelchair reading lips like a prisoner decoding freedom. Everyone in the room is ready to move on until a rookie nurse steps out of the shadows with a battlefield test no textbook teaches. Stay with this story. By the end, you'll know what most people miss when hope looks medically impossible. Like the video and comment where you're watching from. The rain kept tapping the glass like a patient hand asking to be noticed, and for a moment the whole room felt suspended between paperwork and prayer. Admiral Grant Harlan did not look away from his daughter. He watched the tiny movements most people never saw, the way Lily's eyes searched faces for meaning, the way her fingers found the same 3 beats on the wheelchair armrest as if rhythm could replace sound. They had not started in Norfolk. They had started on a bright afternoon outside Chesapeake, the kind of ordinary day that makes disaster feel like a personal betrayal. Grant had been off base for once, out of uniform, holding a coffee he did not finish. Lily had texted him a single line earlier that morning. Back by 6. Love you. She was 16 and trying hard to be grown, still young enough to leave the last word like a handprint on glass. The call came from a stranger's phone. A woman's voice, shaking but controlled, told him there had been an accident at an intersection near the highway. She did not say dead, she did not say alive, she said hurry. Grant drove the way he had driven through storms at sea, straight into the noise mind, narrowing to one goal. When he arrived, he saw red and blue lights washing the asphalt. A crumpled sedan, an ambulance with its doors open like a mouth. A police officer tried to stop him and then failed because something about a father's face ignores procedure. Lily's eyes were open. That was the first thing that kept him standing. Her hair was tangled, cheeks smeared with dust, and there was blood on her collar that looked worse than it was. She tried to speak when she saw him, but the paramedic's hands were already stabilizing her neck. A medic told him she had hit her head, possible concussion, possible inner ear damage unknown. Lily's hand found his wrist and squeezed, then squeezed again, and he understood she was counting him, anchoring herself in the only signal she trusted: medications. The doctor's mouth moved medications. The doctor's mouth moved, while Grant watched Lily, instead watching her focus on his lips as if she needed him to translate reality. Then came the first moment that made his stomach drop. A nurse called Lily's name from the foot of the bed. Lily did not turn. The nurse raised her voice. Lily's eyes stayed fixed on Grant. The nurse moved closer, spoke again. Nothing. Grant leaned down so his daughter could see him clearly. "Lily, can you hear me?" She stared at his mouth, brows knitting, then shook her head, small and terrified. "No, Dad." The word no did not come out loud. It formed on her lips like a secret. She mouthed it and touched her ear as if her own skin had betrayed her. The first hospital in Chesapeake ran tests quickly. They put her in a scan. They shone lights in her eyes. They asked her to push and pull, to follow fingers, to squeeze hands. Her legs did not cooperate, not fully. The doctor said spinal shock, temporary braces, physical therapy. The doctor said she would likely walk again. That part was delivered with confidence, as if the body was a machine that always returned to factory settings if you gave it time. But when it came to hearing, the tone changed. A young resident explained that swelling could distort results. They would reassess later. Grant held on to the word later as if it were a rope. Later became days. Days became weeks. The second opinion came from a private clinic in Raleigh, because Grant's rank opened doors that ordinary families had to knock on for months. He learned quickly that access did not guarantee answers. It only changed the waiting room. Different carpet, better coffee, the same fear sitting in the same place. They played tones in headphones Lily could not hear. They watched her eyes. They recorded her reflexes. They told Grant that the pathways were not responding the way they should. They showed him graphs he did not understand. They used careful phrases the ones doctors use to keep their own hearts out of it. Severe trauma, neural disruption, poor prognosis. Grant nodded, asked for specifics, demanded clarity without raising his voice. He had spent a career reading weather patterns and enemy intent, and now he was reading doctors. Their confidence was measured their uncertainty hidden behind language. He went home at night to a house that sounded wrong. Not quiet, because houses are never truly quiet, but wrong in the way it felt when Lily did not react to anything. A cabinet closing, a microwave beep, the dog barking at a delivery truck. Lily would look up only when she saw movement. She began to smile at people's faces instead of their voices. She began to watch television with subtitles even when nobody asked her to. She began to keep one hand touching the couch or the wall as she walked on unsteady legs, as if the world could be mapped through contact. Grant caught himself doing it too. He began to walk heavier so she might feel him. He began to knock on the table twice before speaking so she would look up. He began to stand directly in front of her, making sure his mouth was visible, because if she could not hear him, he would at least make sure she could read him. At the third hospital, Walter Reed had been mentioned, then a consult, then a transfer arranged through channels Grant wished he did not have to use. He did not like leveraging his rank for personal life. It felt like cheating. It felt like begging. But Lily's world had narrowed to silence, and pride had no place in that room. Everywhere they went, the story hardened. 20 doctors. 3 hospitals. The numbers were repeated by nurses like trivia whispered by receptionists who thought it sounded impressive, as if the count of specialists added weight to the conclusion. It did. It also added exhaustion. On the drive to Norfolk, Lily sat in the passenger seat instead of the back because she hated feeling like cargo. Her braces were hidden under loose pants. Her hands stayed folded in her lap like she was trying to be still enough to disappear. Grant watched her in the periphery the way he watched a horizon. He spoke slowly, face turned slightly so she could see his mouth without him taking his eyes off the road too long. "We'll do this one more time." Lily nodded, then looked out the window. Cars passed their music invisible to her. Sirens in the distance were just flashing lights. When they arrived at the Naval Medical Center in Norfolk, the lobby smelled like antiseptic and old coffee. The floors shined too much. A television on the wall played news on mute. Lily watched it for a second, then looked away. Grant signed in. A petty officer at the desk recognized him and stiffened. Grant hated the reflex. He was not here to be saluted. He was here to be a father with a problem he could not command into submission. They were led to audiology. The wing was quieter than the rest of the hospital. Not because machines were silent, but because voices seemed to lower on instinct. People did not laugh there. People did not talk about weekend plans. It was a corridor built for endings. A nurse pushed Lily's wheelchair, even though Lily insisted she could walk with assistance. Grant allowed the chair because he could see the fatigue in her shoulders. Recovery was not a straight line. Some days she could take 20 steps. Some days she could take 5. In the hallway, Lily's fingers began their tapping again. 3 beats, pause, 3 beats. It was not a song, it was a signal, a habit born in silence. Grant leaned down. "You doing okay?" Lily looked at his mouth, then nodded. Her eyes were steady. Her jaw was not. Inside the consult room, Dr. Klein and 2 residents sat with a stack of files so thick it looked like a legal case. A monitor displayed scans. A chart showed dates, measurements, test results. Grant recognized the shape of bureaucracy. It resembled strategy. It also resembled a trap. Dr. Klein greeted him with professional politeness. No warmth, no cruelty, just efficiency. Admiral Harlan, Miss Harlan. Lily did not respond to her name until Grant touched her hand. When she turned, she offered a small smile that looked practiced in a mirror. Dr. Klein began with summaries. He spoke with the smooth rhythm of someone accustomed to delivering bad news. Grant watched his mouth for Lily's sake, then looked to Lily's eyes to make sure she was tracking. She was. She always did. She had learned survival faster than anyone should. Dr. Klein referenced prior evaluations' imaging audiograms. He used words like confirmed and consistent. He said the injury likely disrupted her auditory pathways. He said there was no meaningful response. When he reached for the discharge papers, Grant felt something cold move through him. Sign here, and we'll coordinate rehabilitation services. He slid the papers across the table, a pen placed neatly on top as if it were a courtesy. Grant stared at the pen. In the Navy, signatures ended missions, approved deployments, locked decisions into place. A signature was a door closing with official force. He looked at Lily. She sat very still in her chair, eyes moving between faces. She looked like she was holding her breath without knowing it. Her fingers continued their pattern on the armrest. 3 beats, pause, 3 beats. Grant recognized the way her shoulders were slightly raised, the way her mouth was set like she was bracing for impact. Dr. Klein kept speaking, offering words meant to sound helpful. Adaptation, programs, tools, counseling. He said them like a list of supplies for a life she did not choose. Grant picked up the pen anyway because he did not know what else to do with his hands. The moment stretched. Then someone shifted near the door. Grant had noticed her earlier, but only as part of the room. A young nurse holding a tablet, standing in the kind of stillness rookies use when they are trying not to be in the way. Her badge read Emma Shaw. Her hair was pulled back tight, not for style, but for function. Her posture was steady in a way that did not match her age. Dr. Klein did not look at her. Grant did, because she was watching Lily differently, not with pity. Not with that careful distance medical staff often used around suffering. Emma watched Lily, like she was collecting details, small ones, the kind that mattered. She watched the tapping. She watched Lily's breathing. She watched where Lily's eyes went when people moved. Emma's gaze flicked to the test date on a report, and Grant saw it because he had been staring at dates too. He had memorized them, turned them over in his head at night like worry stones. 4 days post-accident. 8 days. 2 weeks. Every test stacked early, when Lily's head had been swollen, when she had been vomiting from concussion, when her body had been in shock. Later, retests were fewer, spaced out, done more like confirmations than investigations. Grant had not had the language for it, but he had felt it. They had decided then, they had measured to prove they were right. Emma's throat moved as if she swallowed something. Then she spoke. "Sir, may I ask a question?" Dr. Klein finally looked up, irritation already formed. "Go ahead, nurse." Emma stepped forward a single pace, not into the center, not claiming space, just close enough to be heard, where frequency-based response tests repeated after the swelling stabilized. Her voice was calm, not challenging, not pleading, just precise. The room held still. A resident blinked, looked down at the file, then back up. Dr. Klein's expression tightened, and Grant saw something he had been waiting to see for weeks. Not certainty. A crack. Dr. Klein cleared his throat. Early testing is standard. Later results rarely change prognosis. Emma nodded as if she accepted the sentence on paper. Then she asked with the same steady tone, "Rarely or never?" Dr. Klein stared at her now, and Grant felt the shift in the room. Hierarchy did not like being questioned. Medicine and the military shared that flaw. Grant set the pen down slowly. Lily's tapping stopped for a second, then resumed faster now, as if she felt the tension even without hearing it. Grant turned his chair slightly so Lily could see his mouth. "We're going to ask a few more questions." Lily searched his face, then nodded, trusting him because she had no other choice. Dr. Klein's patience thinned. "Admiral, we are trying to help you accept reality." Grant did not raise his voice. He never had to. "Reality is what you can prove, Doctor." Emma's eyes lifted briefly to Grant, then away. She was not trying to recruit him. She was trying to keep the room from shutting down. Dr. Klein tapped the folder. "The evidence is clear." Emma shifted her weight subtly, like someone adjusting stance on an unstable surface. "Then let me run one quick check. Under observation. No claims, just data." Dr. Klein's mouth tightened into a line. The residents looked uncomfortable, caught between authority and possibility. Grant watched Lily. She sat upright, but her eyes had changed. Not hopeful. Not yet. Just alert. As if her brain recognized that something in the room had moved. Grant's gaze returned to Emma. "What kind of check?" Emma hesitated, not from uncertainty, but from calculation. She chose words the way professionals choose safe routes. A response pathway test. Dr. Klein exhaled through his nose. "We have done enough tests." Grant looked at the discharge papers again. The pen. The neatly printed lines. The clean finality. He pushed the papers a few inches away, slow, deliberate. The scrape of paper against table was small, but in that room it sounded like defiance. Dr. Klein's eyes narrowed. "Admiral, you are delaying your daughter's rehabilitation." Grant leaned closer to Lily and spoke with careful clarity. "You okay if we stay a little longer?" Lily watched his mouth. Her fingers slowed their tapping. She nodded once. Uncertain, but sincere. Grant straightened. "We stay." Emma did not smile. She did not show relief. She simply reached into her pocket as if she had been waiting for permission without ever expecting it. Dr. Klein saw the motion and his irritation spiked. "Nurse Shaw." Emma paused, respectful. "Yes, doctor. This is not a training exercise." Emma met his gaze without flinching. "I know." She took out her phone. Not flashy. Not dramatic. Just a device everyone carried suddenly loaded with something that did not belong in a civilian hospital. Grant watched her thumb hover over the screen. A file. A simple interface. Nothing that looked like salvation. Lily's eyes flicked toward Emma's hand, then back to Grant, reading the question on his face even as he tried to hide it. The hum of the fluorescent lights felt louder. The rain against the glass sounded like pressure. In the hallway outside, footsteps passed, muffled and different. Dr. Klein opened his mouth to end it. Emma stepped behind Lily's chair, positioning herself just out of Lily's direct line of sight. Grant noticed that too. Emma lowered the brightness of the phone until it was barely visible, then looked up, once silently asking Grant if she had permission to proceed. Grant gave a small nod. Emma pressed play. At first it sounded like nothing. Not silence, not music, not even a tone most people would recognize as sound. It was a thin pressure, a whisper of vibration hiding inside the hospital's background noise so faint it could have been mistaken for the ventilation system, or the fluorescent lights settling into their own fatigue. Dr. Klein leaned back as if he had already won. Grant did not look at the doctor. He watched Lily. Lily's fingers completed their 3-beat pattern and then stopped mid-air as if someone had cut the string on a metronome. Her shoulders rose a fraction. Her breath caught. Not the dramatic gasp of a movie patient, just a half-second pause that belonged to instinct. Emma killed the sound immediately. The room held still. Dr. Klein made a dismissive sound with his tongue. She can feel vibration through the chair. That proves nothing. Emma did not answer. She did not even look at him. Her eyes were on Lily's posture, on the tiny tension along her jawline, on the way Lily's gaze drifted without permission toward the space behind her. Grant leaned forward without realizing it. The movement was small, like a commander leaning over a chart table when the numbers stop making sense. Lily blinked twice in quick succession, then tightened her grip on the armrest. Her mouth parted, as if she wanted to speak, but she did not know what to say. Grant lowered his voice so Lily could read him. "Lily, did you feel something?" Lily's eyes searched his mouth, then her brows knit. She looked down at her hand like it belonged to someone else. Then she nodded once, uncertain, embarrassed by her own uncertainty. Dr. Klein reached for the discharge folder again, irritated by how long the room had taken to react. Nurse Shaw, this is not clinically valid. You are creating noise where there is none. Emma finally turned her head toward him, slow and respectful. Then let me remove the noise. She adjusted the phone settings with a quiet competence. She dimmed the screen further, then turned her body so the device was hidden by her palm. She stepped to the left, out of Lily's peripheral vision, and lowered her arm so Lily could not track it with sight. Grant noticed each change. So did Dr. Klein, even if he pretended he did not. Emma looked at Grant, first not Klein, as if Grant was the only one in the room who mattered in this moment. Grant nodded again. Emma pressed play. 2 seconds passed. Nothing. Dr. Klein exhaled, ready to speak. Then Lily's head tilted barely, but not randomly. She turned toward Emma's new position as if her body had caught the direction before her mind could explain it. Her eyes moved, searching the air the way a person searches for a voice in a crowded room. Grant's throat tightened. He had seen that exact motion in wounded sailors waking after sedation. The head turn toward a familiar sound before memory returned. He had seen it in training exercises when a recruit tracked a faint signal under stress. Directionality was not a coincidence. Directionality was a map. Emma stopped the sound instantly. Lily's eyes lingered where Emma stood, then flicked away confused. Her fingers began tapping again, faster now. Not 3 beats, but something uneven, as if her nervous system was trying to turn confusion into pattern. Dr. Klein opened his mouth, but Grant raised a hand. Not a gesture of anger, a gesture of control. Dr. Klein paused anyway. In the military, that hand meant stop. In medicine, it meant nothing, but in that room, it meant everything. Grant looked at Lily and spoke slowly. "Look at me." Lily met his gaze. Grant placed his hand gently on her wrist, grounding her, giving her a signal she could trust. Emma, do it again. Dr. Klein's eyes narrowed. "Admiral, you are crossing into false hope." Grant did not look away from Lily. "I am crossing into verification." Emma shifted again. This time, she moved farther back near the cabinet where the monitor's reflection had been earlier, and she angled her body so there was no chance Lily could see her thumb press the screen. She kept the phone hidden, her wrist relaxed, her breathing controlled. Grant watched her and felt the first real jolt of suspicion, not toward Emma, but toward the entire system. Rookies did not move like that unless someone had trained them in rooms where mistakes cost lives. Emma pressed play. Lily's eyes snapped toward the sound before her head moved. The reaction came faster now, a sequence of tiny events that lined up too neatly to dismiss. Breath pause. Shoulder tension. Eye shift. Head turn. Emma stopped the sound. Lily's brows pulled together. Her lips moved, shaping a question without sound. Grant leaned closer so she could read him. "It's okay, you're okay." Lily touched her ear again, then looked around the room with a frustration that had not existed when she thought the case was closed. This frustration was different. It was not grief. It was pursuit. Dr. Klein cleared his throat louder now, trying to reclaim the room with voice. That is not hearing. That is incidental. People respond to subtle cues all the time. Postural changes. Expectation. She is watching you. She is watching her father. Emma's voice stayed low. Then test her without visuals. Dr. Klein stared at her. "We do not run experiments on patients based on a phone app." Grant's gaze hardened, not hostile, just fixed. "Then run it with your equipment. Or call someone who can." Dr. Klein's jaw clenched. Grant turned to Lily, making sure she could see the seriousness on his face without fear. "One more time. Then we stop unless you want to continue." Lily watched his mouth closely. She hesitated, then nodded again more firmly. Grant looked back to Emma. "Proceed." Emma nodded. She did not celebrate. She did not look triumphant. She looked like a professional who had one job and no time for ego. This time, she took a step behind Lily, then another, creating distance. She placed the phone near her thigh and pressed play with her finger hidden behind her leg. The tone began. Grant kept his hand on Lily's wrist still, so she could not sense a change in him that might cue her. Lily's head turned anyway, not toward Grant, toward Emma. Clean, deliberate, undeniable. Dr. Klein's expression faltered. It was only a flicker, but Grant caught it. Emma stopped the sound. Lily's eyes stayed fixed in that direction for a beat. Then she looked at Grant with a question so raw it made him feel exposed. Grant did not try to comfort her with words. He simply nodded again and squeezed her wrist once, a silent promise that he would not let the room dismiss her reality. Dr. Klein pushed his chair back, frustration rising. This proves nothing. You cannot take micro-movements and build a diagnosis around them. Emma spoke carefully. I am not building a diagnosis. I am building a reason to retest. Dr. Klein lifted the folder slightly as if it were a shield. Her scans show damage. Emma did not argue that either. Scans show structure. This is function. The room went quiet again, but the silence had shifted. Earlier, it was resignation. Now, it was negotiation. Grant looked at Dr. Klein. Who do you call when your conclusions do not match your patient? Dr. Klein hesitated, then forced the answer out. Neurology. Grant nodded once. Call them. Dr. Klein's eyes flashed with irritation, but he reached for the phone on the desk. I will request a consult. Grant watched Lily, who was staring at Emma now with a strange new energy. Lily was not smiling. She was not celebrating. She was concentrating as if her brain had found a door and was pressing her face against it, trying to see through a crack. Emma moved closer to Lily's line of sight and knelt so Lily could read her mouth if she wanted. Did you feel that? Lily watched her lips, then nodded. Where? Lily hesitated, then lifted her hand and pointed near her ear, not to the ear itself, but slightly behind it, as if she was indicating an internal space rather than a physical location. Her eyes were intense with effort. Emma nodded, as if she understood exactly what Lily meant. Grant felt his chest tighten again. That gesture was not learned in an hour. That gesture belonged to someone tracking sensation for weeks, trying to name it without language. Dr. Klein finished the call, then looked at Grant with a tone that tried to remain professional. Neurology will be here, but I want to be clear. This is unlikely to change the outcome. Grant's answer was immediate. Unlikely is not the same as impossible. A resident shifted near the door, pretending to check something on a clipboard while clearly listening. Another nurse passed by in the hallway and slowed down. Hospitals were built on routine, but routine did not like disruption. It drew eyes. Emma stood and stepped back to the wall, returning to invisibility. She had done what she needed to do. Now she waited. Grant leaned toward Lily again. We're going to do more tests. You tell me if you get tired. You tell me if you want to stop. Lily looked at his mouth and then placed her hand on his forearm, a steady pressure that meant continue. Grant held still, letting her anchor herself. Minutes crawled by. The hum of the lights became a living thing. The rain kept ticking. Dr. Klein flipped through files and muttered to the residents about protocol. Grant listened without truly listening. His attention stayed on Lily on every breath, every shift of her gaze, every time her fingers began their rhythm and then stopped when the room held still. Emma's eyes moved quietly between Lily and the monitor reflection in the cabinet glass the way she had earlier. She watched the small physiological details that did not lie. She did not need a dramatic reaction. She needed consistency. Dr. Klein tried one more time to regain control with words. Admiral, I understand your position, but we need to avoid giving her false expectations. Grant did not look at him. Then avoid giving her a false ending. A soft knock sounded at the door. Dr. Klein straightened as if a superior officer had entered. A woman stepped in wearing navy scrubs and a badge that read, Dr. Maya Serrano, Neurology. Her posture was calm. Her face composed, her eyes sharp. She carried a tablet and a sense of quiet authority that did not require volume. Dr. Serrano scanned the room in one pass. She registered Grant's uniform, Lily's chair, the file stack, the tension. She looked at Dr. Klein. What's going on? Dr. Klein spoke quickly, trying to frame the story before anyone else could. Admiral Harlan's daughter has confirmed profound hearing loss following an MVA. Our department concluded permanent loss. Nurse Shaw ran an unauthorized tone test that produced questionable micro-responses. The admiral requested neurology to confirm. Dr. Serrano's eyes flicked to Emma for a half-second. Nurse Shaw. Emma nodded. Yes, ma'am. Dr. Serrano looked at Lily, then at Grant. Admiral. Grant nodded once. Doctor. Dr. Serrano approached Lily, lowering herself slightly so Lily could see her face. Hi, Lily. I'm Dr. Serrano. Lily watched her mouth, then glanced at Grant. Grant spoke gently. She can't hear. She reads lips. Dr. Serrano nodded, then spoke slower, precise mouth movements. Okay, we can work with that. She turned to Dr. Klein. Show me the reports. Dates, tests, everything. Dr. Klein slid the files across. Dr. Serrano skimmed quickly. Grant watched her eyes move the way they paused on certain lines. 4 days post-accident. A week. A month. Dr. Serrano looked up. Most of this testing was done early. Dr. Klein bristled. That is standard. Dr. Serrano did not argue. Standard does not mean complete. She set the files down and looked at Emma. What did you use? Emma answered without theatrics. A frequency tone file used to check hidden auditory pathway response after blast injury. Dr. Serrano's gaze sharpened. Where did you get it? Emma held her expression steady. I had access to it. Dr. Serrano did not press further in front of the room. She turned back to Lily. Lily, I want to see something. She signaled to a resident. Wheel her to neurology. We can run auditory evoked potentials. We will test recognition at the brainstem level. Dr. Klein's annoyance flared. This is a waste of resources. Dr. Serrano looked at him with quiet firmness. If you are certain, you will enjoy the confirmation. If you are wrong, you will want the correction. Dr. Klein's mouth closed. Grant stood, his hands returning behind his back out of habit. He looked down at Lily. We're going. Lily nodded quickly, almost eager, then caught herself and tried to look calm. Her fingers resumed their tapping, but the rhythm had changed. It was steadier now, as if she was holding on to something new. As the resident unlocked the wheelchair brakes, Emma stepped forward and adjusted Lily's blanket without asking. It was a small act, normal nursing care, but it grounded the moment in reality. Lily looked up at her and held her gaze, a silent request for the tone again. Emma did not play it. Not here, not now. She simply nodded once, telling Lily she understood, and stepped back. They moved into the hallway. Outside, the hospital continued its usual pulse. Doors opening and closing. Phones ringing. Footsteps. Voices. None of it reached Lily's ears, but she watched it all with a heightened focus, reading the world like it was a code. Grant walked beside her chair, matching pace. He kept his body angled so Lily could see his face when he spoke. You're doing great. Lily nodded. Her eyes were fixed ahead. Dr. Klein followed with his resident's irritation contained behind professionalism. Emma walked a step behind, just off to the side, deliberately making herself small again. But Grant could feel her presence. He could feel that she was not a bystander. She was a variable the system had not accounted for. As they entered the neurology wing, the air changed. It felt quieter, heavier, like the building itself understood what was at stake. A technician met them with a clipboard and a practiced calm. We'll set her up in room 3. Dr. Serrano spoke with crisp efficiency. Electrode, cap baseline readings, then stimulus sequence. Keep the environment controlled. Minimal movement. We need clean data. Grant watched the staff move, attaching meaning to every word he understood and storing the ones he did not. Baseline, stimulus, clean data. Lily's eyes flicked to the equipment being rolled in. Wires, sensors, a screen that would show things no one could see with the naked eye. She looked at Grant. Her lips formed 2 words without sound. Am I crazy? Grant's throat tightened. He forced his face to remain steady. No. He spoke slowly so she could read him. You are not crazy. Lily blinked hard and nodded, holding on to that sentence as if it were a life jacket. Dr. Serrano glanced at Grant. We will not promise anything, but we will test thoroughly. Grant nodded once. That's all I want. Emma stood near the doorway now, hands folded, watching the room take over the process she had forced into existence. She did not look satisfied. She looked attentive, like she was waiting for the data to speak before anyone decided what it meant. Dr. Serrano gestured toward the chair where Grant could sit. "We need you still. She will watch you, that's okay, but we need to minimize cues." Grant sat posture straight, hands resting on his knees, for once the posture of a man who had spent a career controlling outcomes, now forced to watch. The technician began placing sensors along Lily's scalp, careful and gentle. Lily flinched once, then steadied herself. She looked toward Grant and held his gaze. Grant did not look away. The room settled. The screen powered on waveforms, blank and waiting. Dr. Serrano looked at Dr. Klein. "If you want to stand behind certainty, stand here and watch." Dr. Klein crossed his arms and took his place, jaw tight. Dr. Serrano glanced once at Emma. "Nurse Shaw, stay. You saw something first." Emma nodded and remained by the wall. The technician finished attaching the sensors. Dr. Serrano checked the settings. Then she spoke to Lily slowly with clear mouth movements. "We will play tones. You do not need to do anything. Just relax." Lily nodded. Her eyes closed for a second, then opened again as if she did not trust herself to miss anything. Dr. Serrano raised her hand. "Begin baseline." The room became still enough that even the rain felt distant. And for the first time since the accident, Grant watched a machine prepare to answer a question that had been swallowing his home whole. The technician's fingers moved with practiced gentleness, smoothing the electrode cap along Lily's scalp, pressing each sensor into place as if tucking in tiny anchors. A thin line of gel glistened under the fluorescent light. Lily sat very still, shoulders tight, eyes fixed on her father's face like it was the only safe landmark in a shifting world. Grant kept his breathing slow and even. He had learned long ago that panic was contagious. On ships, fear spread faster than fire. In hospital rooms, it did the same, only quieter. He placed both hands flat on his knees and forced them not to tremble. Dr. Serrano leaned toward the monitor. The screen showed waves that meant nothing to Grant at first, just a trembling line moving across a dark field. She adjusted a dial, then another, narrowing the noise, chasing a signal that might be hiding inside the static. Dr. Klein stood near the back, arms crossed, posture rigid. The residents hovered close to him, not quite choosing sides, not quite pretending they had none. Emma remained against the wall by the door, hands folded, gaze steady. She did not look like someone waiting to be proven right. She looked like someone waiting to see what was true. Dr. Serrano raised her voice slightly, not loud, just clear enough for the room. "We are starting baseline. No movement. Minimal talking." She turned to Lily and spoke slowly, shaping each word so Lily could read it. "You do not have to do anything. Just breathe." Lily nodded once, then tightened her grip on the armrest as if her body refused to believe it could be passive. The technician tapped a key. The monitor line settled into a quieter rhythm. Dr. Serrano watched for a few seconds, then held up her hand. The gesture was small but commanding. Stimulus. A tone played through the equipment, not Emma's phone. It came from a calibrated source fed through specialized transducers designed to remove every excuse. It was still faint, still nothing. Grant could clearly identify as sound, but the room felt it, the way you feel a change in pressure before a storm hits. Lily did not flinch. Grant's heart sank for a fraction of a second. Then Lily's breathing changed. It was subtle. Her inhale shortened, her exhale stalled, then resumed as if her body had hesitated on a cliff edge. Her fingers stopped tapping entirely. Her jaw tightened. Dr. Serrano's eyes narrowed. A small rise appeared on the waveform. It was not dramatic. It did not spike like a victory. It lifted like a cautious hand, then dipped again. Dr. Klein scoffed softly. Artifact. Muscle tension. Dr. Serrano did not look at him. Run it again, same setting. The tone repeated at a slightly different interval. The waveform rose again, delayed but consistent. Dr. Serrano leaned closer, lips pressed tight in concentration. She held up 2 fingers to the technician. 2 more changed the angle. The technician shifted the transducers and ran the sequence again. Another faint response appeared, not identical but related, like a signature written by the same hand. Grant could not interpret the screen, but he could interpret the people watching it. The room's energy had shifted. The residents were no longer bored. They were no longer politely sympathetic. They were alert, like sailors spotting a shape on the horizon. Dr. Serrano lifted her gaze to Grant. This is not definitive, but it is not nothing. Grant nodded once. Lily's eyes flicked from Dr. Serrano to Grant, reading the tension in his face, even if she could not hear the change in his breath. Dr. Serrano turned back to the screen, then to Lily. Lily, I need you to keep your eyes forward. Just relax your shoulders. Lily tried. Her shoulders lowered a fraction, then rose again, like her body forgot how to obey. Emma stepped forward from the wall, careful not to draw attention. She moved to Lily's side and lowered herself to Lily's eye level. She spoke slowly, mouth clear. Breathe with me. Lily stared at her lips, then followed. Inhale, exhale, inhale. The line on the monitor steadied. Dr. Serrano noticed immediately. Keep that. Good. Dr. Klein's posture stiffened. It was not anger now. It was discomfort, the kind that comes when reality refuses to stay in its assigned category. Dr. Serrano turned slightly, addressing him without turning it into a battle. Your reports said no meaningful response. This suggests there is some engagement. Dr. Klein's jaw flexed. Delayed engagement. Could still be non-functional. Dr. Serrano nodded, accepting the caution. Agreed. That is why we test further. She adjusted another setting. The next tone was not just a frequency. It carried a pattern, a rhythmic pulse inside the sound like a code. The technician triggered it. Lily's eyelids fluttered, then closed briefly. Not sleep. Focus. Her fingers lifted from the armrest, hovering as if her hand wanted to reach towards something she could not quite locate. Grant felt his breath catch. He forced it back down. A stronger waveform appeared. Still small, still fragile, but more coherent, more organized. One of the residents whispered without meaning to. That is consistent. Dr. Klein snapped his eyes toward him, and the resident fell silent, face flushing. Dr. Serrano held up her hand again, stopping the room. She looked at the technician. Repeat, random interval. The technician nodded, then waited an unpredictable length of time before triggering the stimulus again. Lily responded again, not with a dramatic head turn, with a measurable change in breath and tension that lined up with the tone. Dr. Serrano exhaled slowly and removed her glasses, rubbing the bridge of her nose as she stared at the screen. She put the glasses back on and looked at Grant. Her auditory cortex does not appear inactive. It appears suppressed. Grant repeated the phrase under his breath as if saying it made it real. Suppressed. Dr. Serrano nodded. It can happen after trauma. The brain sometimes blocks input to protect itself. Dr. Klein's voice sharpened, defensive and professional. That is a theory, not a diagnosis. Dr. Serrano's tone stayed even. It is a working explanation supported by repeatable data. That is why we continue. Grant watched Lily. Lily's eyes were open now, fixed on Dr. Serrano's mouth, trying to catch meaning. Grant leaned forward and spoke so Lily could read him. They see something. Not a promise, something. Lily's lips parted. Like what? Grant chose words he could own. Like a door that might be stuck, not broken. Lily's eyes glistened for a second, then she blinked hard and swallowed. She nodded once too quickly, as if she wanted to accept it before it could be taken away. Dr. Serrano signaled the technician to stop. That is enough for now. We have baseline responses. We need to confirm with additional protocols and review imaging again. Slowly, she turned to Dr. Klein. I want a full re-evaluation of the earlier scans. I want dates, swelling markers, any notes about sedation or medication that could have affected results. Dr. Klein's mouth tightened. We already reviewed those. Dr. Serrano looked at him with calm firmness. Then you will review them again. The residents shifted, uncomfortable but relieved. No one liked being wrong, but no one liked being trapped in a wrong conclusion either. A new pathway, even a difficult one, gave everyone something to do besides surrender. Dr. Serrano stepped away from the monitor and approached Lily. She spoke slowly, clear mouth movements. "You did very well. We are going to take a break." Lily nodded, then lifted her hand and pointed to her ear again, then to the equipment, then to Dr. Serrano's mouth. A silent question. Dr. Serrano watched the gesture, then looked at Grant. "She is asking if she heard something." Grant nodded. "Yes." Dr. Serrano considered her answer carefully, then spoke to Lily. "You may not hear it like you remember, but your brain is noticing something. That matters." Lily's face tightened. Her eyes dropped for a second, then rose again, determined and scared. Emma stepped back to the wall again, returning to silence. But Dr. Serrano's eyes followed her. "Nurse Shaw." Emma lifted her gaze. "Yes, ma'am." Dr. Serrano's voice lowered, not secretive, just less public. "You said you used a blast injury frequency file. That is not common knowledge in a civilian setting." Emma's expression remained neutral. "It is a tool." Dr. Serrano studied her. "Where did you learn it?" Emma's hesitation was brief but real. Not fear, calculation. "Field medicine." Dr. Serrano's eyes narrowed slightly. "That is not an answer." Emma kept her voice calm. "It is the answer I can give." Dr. Serrano did not press further, not in front of patients, not in front of a room full of ego. She filed it away the way experienced clinicians file away anomalies to revisit when the moment is right. Dr. Klein interrupted, voice clipped. "Even if there is minimal response, it does not change the functional outcome. The family needs to focus on adaptation." Grant's head turned toward him slow. Dr. Klein straightened as if bracing for an attack. Grant did not attack. He clarified. "Doctor, if my daughter's brain is responding, then adaptation may still be part of the plan, but it is not the only plan. We do not close the case while the data is still talking." Dr. Klein's eyes flicked to the monitor, then away. Dr. Serrano spoke before the tension could harden. "We will create a controlled stimulation protocol. Low-intensity structured. We will track responses. We will not overload her." Grant nodded once, absorbing each word like an order. "How soon?" Dr. Serrano chose her words with care. "We can begin today with very gentle sessions, then daily. We will monitor for fatigue and headaches. We will coordinate with rehab." Grant looked to Lily. "Lily, you want to try?" Lily's answer was immediate. She nodded hard, then seemed to realize she had moved too fast and forced herself to settle. Her fingers started tapping again, but the pattern had changed. It was steadier, as if she had a metronome inside her that refused to die. Dr. Serrano signaled to the technician. "Remove the cap carefully, then move her to the therapy suite." Watched Emma's hands and realized. Watched Emma's hands and realized something that unsettled him. She moved like someone trained to stabilize people under pressure, not just bodies, but minds, the kind of calm that came from having seen worse than this. As they rolled Lily into the hallway, people looked up. Some recognized the uniform. Some recognized the tension. Rumors in hospitals traveled faster than infection. A closed case had reopened. A rookie nurse had asked a question that forced senior staff to answer. Grant walked beside Lily's chair, keeping his shoulder close enough that she could feel him if she needed to. Dr. Serrano walked on the other side, speaking in measured phrases to a resident about protocols. Dr. Klein followed a step behind, face tight, as if he were accompanying them out of obligation rather than choice. Emma remained just behind Lily's headrest, hands near the handles, guiding the chair through turns with smooth precision. Lily glanced back at Emma, then pointed to Emma's pocket, the phone. A request, not for entertainment, for confirmation. Emma did not pull it out. She shook her head gently and met Lily's eyes. She mouthed words slowly. "Later, with the doctor." Lily's shoulders dropped a fraction, disappointed but understanding. The therapy suite was warmer than the testing room, less sterile, but still clinical. There were padded chairs, sound-dampening panels, equipment that looked like it belonged in both a lab and a music studio. A therapist introduced herself, then spoke slower when she noticed Lily's eyes tracking her mouth. Dr. Serrano spoke to the therapist. We suspect suppressed auditory processing. Start with rhythmic pulses layered under low-frequency stimulation. Keep intensity minimal. We want engagement, not overload. The therapist nodded and began preparing the equipment. Grant stood near the corner, hands behind his back again out of habit. But the posture felt different now. Less command, more restraint. He was waiting, and he hated waiting because waiting was what you did when you could not act. Lily was positioned in a comfortable chair. Her braces were adjusted. A soft blanket was placed over her knees. Emma ensured Lily's hair was pulled away from her face so Lily could read lips without distraction. Dr. Serrano knelt slightly so Lily could see her. We will play gentle patterns. If you feel dizzy or tired, tell us. You can tap your father's hand. Lily nodded, eyes fixed. Grant moved closer and offered his hand. Lily took it immediately, fingers cold and strong. The therapist began with a low pulse pattern, not loud, just present. The equipment emitted a barely audible vibration. Grant could hear it faintly. Lily could not hear it as sound, but her body reacted as if something brushed the edge of awareness. Her eyes narrowed. She leaned forward a fraction. Her breathing changed. Emma watched closely, gaze flicking between Lily's face and her hands between Lily's shoulders and her neck. She looked for signs of stress, signs of overload, the kind of microsignals that came before a patient crashed. Dr. Serrano watched the monitor readouts associated with the therapy equipment, measuring small physiological changes. The therapist adjusted timing, creating patterns that repeated and then shifted, forcing the brain to work rather than drift. After a few minutes, Lily's fingers began tapping again, not nervous, not random. They tapped in time with the rhythm. Grant stared at her hand. The taps were faint but consistent. The same 3-beat pattern from before had become something else. It had become imitation. Lily's lips moved without sound. Again. Grant leaned closer. You want again. Lily nodded, eyes bright and fierce. The therapist repeated the pattern. Lily's tapping matched it again. Dr. Serrano's face softened for a brief second, then hardened back into clinical focus. She did not allow herself the luxury of belief. She allowed herself evidence. Dr. Klein stood near the doorway now, arms no longer crossed, hands clasped in front of him, posture unsettled. His eyes were on Lily's hand on the rhythm. His mouth opened once closed again. Emma remained quiet, but Grant could feel her attention like a pressure in the air. She was listening to the room without ears reading it the way Lily had been forced to. After another run, Lily's eyes closed briefly, then opened as the pattern stopped. Her face tightened with a kind of frustration that made Grant's chest ache. She looked at her father and touched her ear again, then shook her head as if angry at herself. Grant squeezed her hand gently. It's okay. Lily looked at his mouth, then mouthed words carefully. Not okay. The admission hit Grant harder than any doctor's verdict. Lily had endured the weeks of silence with a calm that frightened him. This was different. This was fight. Dr. Serrano spoke softly to the therapist. Stop there. Give her a break. That is enough stimulation for one session. The therapist nodded and powered the equipment down. Lily's eyes darted to the machine as it went quiet. Her fingers continued tapping for a moment, then stopped, as if her body was reaching for a sound that had vanished. Emma stepped closer, offered Lily a cup of water with a straw and waited for Lily to accept it. Lily drank, then pushed it away and looked straight at Emma, eyes narrowing. Emma spoke slowly, mouth clear. You did good. Your brain is working. Lily's eyes softened for a second, then tightened again. She lifted her hand and made a small motion, as if pulling something toward herself. A sign invented in the moment. Bring it back. Emma nodded once, acknowledging the request even while honoring the boundary. Dr. Serrano turned to Grant. We need to keep this controlled. If we push too hard, we can trigger headaches, nausea, setbacks. But she is engaging. Grant nodded, absorbing the caution. Dr. Klein spoke quieter now, as if volume could not survive in the presence of new data. Engagement does not equal hearing. Dr. Serrano's response was calm, true. But engagement is the prerequisite for recovery. Dr. Klein's lips tightened. Recovery is a dangerous word. Grant looked at him. So is permanent. The room went still. Dr. Klein looked away first. A nurse entered with a chart update. Dr. Serrano began issuing orders for follow-up tests, scheduling additional imaging review, coordinating with speech therapy, physical rehab, and audiology. The system was moving again, not toward ending, but toward checking. Emma stood slightly apart, listening. Grant watched her and realized she was careful to stay on the edge. She had forced the question into existence, and now she was letting the institution own it. That was not meekness, it was strategy. As staff moved in and out, Dr. Klein's gaze kept returning to Emma, not with dismissal now, with recognition that irritated him because it implied he had missed something a nurse had seen. He finally approached Dr. Serrano, voice low, that tone she used earlier. It was not standard. Are we comfortable letting that influence our process? Dr. Serrano looked at him evenly. The tone did not influence the process. The patient response did. The tone was simply a stimulus. Dr. Klein's jaw flexed, and the nurse. Dr. Serrano's eyes shifted to Emma again. The nurse noticed what you did not. Dr. Klein's face tightened, because she was lucky. Dr. Serrano's reply was quiet and sharp. Luck does not repeat on a monitor. Grant watched the exchange, reading pride in Dr. Klein's posture, reading irritation in the way his shoulders held tension. Pride was a familiar enemy to Grant. It had sunk ships. It had ruined careers. It could ruin medicine, too. Lily shifted in her chair and looked up at Grant again. She mouthed, "Home." Grant swallowed. "Not yet." He formed the words carefully so she could read them. "Not yet. We stay. We keep checking." Lily stared at his mouth for a long moment, then nodded slowly. She did not like it, but she trusted him. Emma approached Lily and mouthed a question. "Tired." Lily hesitated, then nodded. Emma adjusted the blanket again, tucking it around Lily's knees with the same efficiency she had used earlier, grounding Lily in care. Dr. Serrano spoke to Grant. "We will admit her for observation. Short term. We need continuity. We need controlled sessions." Grant nodded. "Do it." A resident looked at the admission paperwork. "We will need insurance authorization." Grant's expression did not change. "You will get it." The resident nodded quickly and left. Dr. Serrano moved closer to Grant, lowering her voice. "Admiral, I want to be transparent. Some patients with suppressed processing regain partial function. Some regain more. Some plateau. But the diagnosis of total loss is not supported by what we just saw." Grant held her gaze. "Thank you." Dr. Serrano nodded once, then turned away to speak with staff. As the room settled into logistics, Emma moved toward the hallway to retrieve supplies. Dr. Klein watched her go, then followed a few steps behind, stopping near the doorway. His voice was low enough that the others could not hear. "Nurse Shaw." Emma paused, turned expression neutral. "Yes, doctor." Dr. Klein's eyes flicked to the pocket where her phone had been earlier. That file, that technique. It is not something a new nurse learns in a hospital orientation. Emma's gaze stayed steady. "No, doctor." "Where did you learn it?" Emma's pause was a fraction longer this time. "Field medicine." Dr. Klein's irritation sharpened. "That is vague." Emma did not raise her voice. "It is accurate." Dr. Klein stepped closer just enough to press. "What unit?" Emma's eyes did not move. "I am here to do my job." Dr. Klein's mouth tightened as if he wanted to say more. Then he caught himself. He glanced toward the therapy chair where Lily sat, watching mouths and faces, tracking a conversation she could not hear. Dr. Klein's tone shifted, forced, softer. "You understand the implications. If our conclusion was wrong, there will be review." Emma's reply was quiet. "Then it should be reviewed." Dr. Klein stared at her for a long moment, then turned away, frustration simmering under professionalism. Emma walked down the hallway without changing pace. Grant watched her go and felt the unsettling certainty that Emma was not simply a nurse who happened to know a file. She carried herself like someone who had learned to keep secrets because secrets kept people alive. Lily's gaze followed Emma too. Then Lily looked back to Grant, eyes asking a question she could not form. Grant leaned closer, mouth clear. She helped. Lily nodded once, then looked down at her own hands. Her fingers began tapping again, slower now, as if she were practicing the rhythm she had matched, trying to hold on to it before it slipped away. That evening, Lily was moved to a private room for observation. The hallway outside was dimmer. The rain had eased into a steady drizzle. The hospital's night shift took over with the quiet efficiency of people who lived in corridors like these. Grant sat in a chair beside Lily's bed uniform jacket, folded over the back. He had loosened his collar, but his posture remained upright the way he sat on long watches. Lily lay back, eyes open, staring at the ceiling as if it might offer subtitles. A nurse entered, introduced herself, and spoke slower once Grant gestured to Lily's hearing loss. The nurse checked vitals, wrote notes, left again. Grant leaned toward Lily. "They are going to keep testing." Lily turned her head so she could see his mouth. "Why?" Grant chose the simplest truth. "Because you responded." Lily's eyes widened slightly. "I did." Grant nodded. "Yes." Lily stared at him, then touched her ear again, pressing her fingers against the skin like she was trying to press a button inside herself. Her mouth formed words. "I want it back." Grant swallowed. His eyes burned, but he did not let tears fall. Not because he feared them, but because Lily needed him stable. "We are trying." Lily nodded slowly, then closed her eyes for a moment, exhausted by effort that no one else could see. A soft knock came at the door. Emma stepped in carrying a small tray of supplies and a cup of water. She paused when she saw Grant in the chair and Lily in bed, then moved with quiet respect. Grant stood. "Nurse Shaw." Emma nodded. "Sir." Lily's eyes opened and locked onto Emma's face immediately. Not gratitude, not relief. Recognition. Emma stepped closer to the bed and spoke slowly so Lily could read her mouth. "How do you feel?" Lily stared, then mouthed. "Tired." Emma nodded. "Good tired." Lily's lips tightened. "Sound." Emma's gaze flicked to Grant, then back to Lily. "Soon." Grant watched Emma's face as she spoke that word. It was careful. Not a promise, not a performance, a boundary. Grant stepped slightly closer, lowering his voice. "What exactly did you test in that room?" Emma met his eyes. "Response pathways. Not hearing as people think of it. The brain's ability to detect, track, and anticipate a stimulus." Grant nodded. "Why did nobody else do that?" Emma's answer came without bitterness. "Because they saw the scans and stopped looking." Grant absorbed that, then asked the question that had been tightening in his chest since the consult room. "How did you know to look?" Emma's expression remained calm, but something moved behind it like a door locked from the inside. "I have seen it before." Grant held her gaze. "In the military." Emma did not confirm, did not deny. She simply adjusted the blanket at Lily's feet, then checked the monitor leads with the ease of someone used to equipment. Lily watched Emma's mouth intensely, then mouthed. Again. Emma's hands paused. Grant felt his body tense. Part of him wanted to say yes. Part of him feared pushing too far. Emma looked to Dr. Serrano's note on the chart. Then she looked back to Lily. "Not now, rest." Lily's eyes flashed with frustration. Emma leaned closer and spoke with slow precision. "Your brain needs breaks, so it can learn." Lily stared at her, then reluctantly nodded, as if the logic landed even inside her anger. Emma straightened and looked at Grant. "Dr. Serrano will run more controlled tests in the morning. They will document everything." Grant nodded. "Thank you." Emma's gaze softened slightly. She did the hard part. She kept trying. Grant looked at Lily. Lily's eyes had closed again, but her fingers moved faintly against the sheet, tapping the rhythm once, then stopping like a prayer disguised as a habit. Emma turned toward the door. Dr. Klein was there, watching from the hallway. His face was unreadable, but his eyes were sharp. Emma stepped out. The door remained slightly ajar. Grant could not hear their words clearly, but he could see their posture. Dr. Klein leaned in, speaking low. Emma stood still, shoulders relaxed, unbothered by pressure. Dr. Klein's chin lifted slightly, a gesture of authority. Emma did not flinch. Then Emma turned and walked away. Dr. Klein stood alone in the hallway for a moment, looking after her with something that was no longer dismissal. It was recognition mixed with unease, like he had realized the rookie nurse carried a history that did not fit her badge. Grant sat back down beside Lily's bed. The hospital's night sounds filled the room, soft footsteps, distant carts, rolling muted voices. He stared at his daughter's face, at the slight tension in her brow, even in sleep, and felt something unfamiliar settle into his chest. Not hope, not yet. Something harder, more disciplined. A refusal to accept a closed door when he had just seen a crack of light. In the morning, Dr. Serrano returned with fresh eyes and a thicker chart. She began the day the way surgeons begin, by washing hands and clearing rooms of noise. The staff moved with a different energy now. Less routine, more care. People spoke quieter around Lily's room. People checked details twice. Grant stood near the window while Lily sat upright in bed. Braces, adjusted hair brushed back. She looked pale, but awake. Her eyes were alert in a way they had not been in weeks. Dr. Serrano spoke to Lily slowly. "We will test again, then therapy." Lily nodded. Dr. Serrano looked at Grant. "We will run another series. We will vary frequency, rhythm angle, and timing. We will check consistency. We will document everything." Dr. Klein entered behind her, face composed. He carried a folder thicker than yesterday and the weight of someone who had spent the night reviewing the same scans with new doubt. Dr. Serrano nodded at him. "Doctor." Dr. Klein nodded back, then looked at Grant. "Admiral." Grant returned the nod. Dr. Klein spoke carefully, as if each word was a piece on a board he could no longer control. "I reviewed the earlier diagnostics. There is a possibility that acute inflammation impacted results more than we accounted for." Grant did not respond with anger. Anger was wasted fuel. Dr. Serrano took the lead. "We do not need apologies yet. We need accurate data." Dr. Klein's mouth tightened, but he nodded. Lily watched their mouths, tracking the tension. She looked to her father. Grant leaned closer. "They are checking again." Lily's eyes narrowed. "Why now?" Grant's answer was honest. "Because someone saw something." Lily's gaze flicked toward the door, searching for Emma. Emma appeared a moment later, entering with the quiet competence of someone who belonged in the room, even if the hierarchy did not want to admit it. She placed supplies on a counter, then moved to Lily's side. Lily's lips formed a word. "Sound." Emma nodded once. "Work." Dr. Serrano directed the team to neurology again. The corridors felt different today. The air carried a tension that was not fear, but attention. Inside the neurology testing room, the equipment was ready. The monitor waited. The electrodes were placed again. Dr. Serrano looked at Lily. "Just breathe." Lily nodded. Grant took his seat again, hands flat, body still. The first tone played. The waveform rose. It was still delayed, still fragile, but present. Dr. Serrano's eyes sharpened. Again. Another tone, another response. She varied the pattern. Lily's body responded in sequence. Dr. Klein stood silent now, watching the screen, watching his certainty dissolve into data. A resident murmured, almost reverent, "It is reproducible." Dr. Serrano nodded. "That matters." Lily's eyes closed briefly, then opened. She looked toward the equipment, and then toward her father, mouth forming words. "I feel it." Grant's throat tightened. Dr. Serrano stopped the sequence. "That is enough. Now therapy." In the therapy suite, the rhythm patterns resumed, slightly adjusted based on the morning's data. The therapist spoke slowly to Lily, guiding her through sensations she could not fully name. Lily tapped along, matching, missing, trying again. The room held its breath each time she matched, not because it meant victory, but because it meant learning. At one point, the therapist layered a faint, spoken syllable beneath the pulse, too soft for most ears designed to ride vibration. Lily's face changed confusion and effort colliding. She frowned, then looked at Grant sharply. Grant leaned in, mouth clear. "What?" Lily's lips trembled as she tried to shape something. Nothing came out, not yet. She clenched her fists, angry. Emma stepped closer and steadied her hands, not restraining, just grounding. "Slow." Lily stared at her, then forced her breathing to slow. Dr. Serrano watched the readouts, then spoke to the therapist. "Reduce intensity. Increase spacing. We want her to anticipate without strain." The therapist adjusted. Lily's tapping steadied. The session ended with Lily exhausted, but alert, the kind of exhaustion that comes from fighting inside your own skull. Grant stood beside her chair as she was rolled back toward her room. He looked at Dr. Serrano. "Is it real?" Dr. Serrano met his gaze. "The responses are real. The question is how far function returns." Grant nodded once, accepting the uncertainty the way he accepted weather at sea. He looked down at Lily, who was staring at Emma's face again, as if Emma's mouth held the map back to sound. Emma kept her posture calm. Her presence was quiet but in the center of the storm. And the hospital, for the first time in weeks, was no longer telling Grant to accept silence. It was working to understand it. The days that followed stopped feeling like days. They became sessions, measurements, small gains that looked like nothing if you expected miracles and looked like everything if you had lived inside silence. Lily woke early now, before the nurses changed shift, before the hallway filled with carts and morning chatter she could not hear. She sat up in bed with her braces adjusted and her hair pulled back so she could read every mouth that entered the room. Her eyes stayed sharp. Her patients did not. Grant learned the new routine the way he learned operational briefings. He watched. He asked questions once, then remembered the answers. He tracked Lily's fatigue the way he tracked fuel and weather. He watched for headaches, for nausea, for the subtle way her shoulders rose when the stimulation pushed too far. He did not tell anyone he was keeping count. He did not have to. It was in the way he stood beside her chair, close enough that Lily could feel him angled, so she could read him without asking. Renee moved with the calm of someone used to the routine. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist. She was a woman named Renee. She was a therapist, Renee, moved with the calm of someone used to rebuilding people one quiet detail at a time. She did not treat Lily like a case study. She treated her like a person with a nervous system that had been forced to hide. Renee began each session the same way. She waited until Lily's breathing settled. She checked Lily's eyes for strain. She made sure Grant's hands were still because Lily watched him even when she tried not to. Then she started with pulses gentle and structured rhythms that did not ask Lily to hear like she used to. They asked her to recognize. Lily's fingers tapped on the armrest, matching when she could, missing and trying again when the pattern shifted. When she matched, her face tightened in concentration. When she missed, anger flashed across her features like a spark. The anger was new. It frightened Grant at first because it meant Lily had stopped accepting loss as normal. Emma remained present, never centered. She moved between roles without drawing attention to it. Sometimes she adjusted Lily's blanket or checked her vitals. Sometimes she stood by the wall watching the smallest changes in Lily's breathing. Sometimes she stepped closer and guided Lily's hands when frustration made Lily tremble. Emma did not speak much. When she did, she spoke in short, clean phrases. She used her mouth like a tool, slow and clear, so Lily could read without strain. She never gave Lily an easy promise. She gave her a structure. Breathe. Try again. Rest. Grant noticed how Lily watched Emma differently than she watched the doctors. With doctors, Lily tried to decode. With Emma, Lily tried to connect. After the third day of sessions, Dr. Serrano returned with new printouts and a different look in her eyes. Not celebration. Focus. She had been reviewing Lily's scans again line by line, searching for what had been missed when everyone believed the case was closed. She gathered Dr. Klein and his residents in the conference room where the discharge papers had once waited. Grant sat at the table. Lily sat beside him, wheelchair positioned so she could see every face. Dr. Serrano spoke with precise mouth movements, aware Lily was watching. The evoked potentials are consistent. Delayed, but consistent. This pattern does not fit total pathway destruction. Dr. Klein's jaw tightened, but he did not interrupt. Dr. Serrano tapped the timeline on the chart. The early tests were conducted during acute inflammation and heavy medication. That matters. It can suppress responses and distort thresholds. Dr. Klein's voice was quiet. Our protocols account for that. Dr. Serrano's reply was calm. Your conclusion did not. A resident swallowed hard. Another looked down at the table, ashamed to be seen watching. Grant's hands were clasped on the tabletop. He kept his posture controlled, but his eyes never left Dr. Klein. He was watching for what sailors watched for in storms. Not waves. The moment the wind shifted. Lily stared at Dr. Klein's mouth as if she could pull truth out of it by force. Dr. Serrano continued. We are labeling this as suppressed auditory processing with potential for functional improvement. We will continue controlled stimulation therapy and track objective markers. Grant leaned toward Lily and spoke slowly. They are changing the diagnosis. Lily's eyes widened. She mouthed, not deaf. Grant did not promise her that. He chose the truthful line. Not proven permanent. Lily blinked hard and looked down, swallowing something deep. Dr. Klein finally spoke again. His voice carried less authority now and more caution. I want it noted that improvement may still be limited. Families can misinterpret progress. Grant's gaze hardened. My daughter knows the difference between misinterpretation and sensation. Dr. Klein held Grant's eyes, then looked away. The meeting ended without applause, without cinematic victory. It ended with paperwork, updated orders, new schedules. The machine of the hospital shifted direction. It did not admit it had been wrong. It simply began behaving as if wrongness was possible. Outside the conference room, Grant walked beside Lily's wheelchair as Emma pushed from behind. Lily kept turning her head slightly, searching for Emma's face, as if she wanted to ask something she could not yet form. Grant noticed and slowed his steps until he was close enough to speak directly into Lily's line of sight. "You want to ask her something?" Lily stared at his mouth, then nodded. Grant glanced back at Emma. "Nurse Shaw." Emma's eyes lifted. "Sir." Grant stopped in the corridor near a quiet alcove where a vending machine hummed and no one else was close enough to overhear. "My daughter keeps pointing to your phone. She keeps asking for the tone. She trusts it. She trusts you." Emma nodded, calm. "It is familiar to her now." Grant studied her face, searching for any hint of performance. There was none. "Dr. Klein wants to know where you learned it." Emma's gaze did not shift. "He has asked." Grant lowered his voice. "And you keep giving him half answers." Emma's mouth tightened slightly, not anger, just restraint. Because half answers are safer than full ones. Grant felt something settle deeper in his chest. He recognized the logic. In the military, details were currency. You did not spend them unless you had to. Lily reached out suddenly from the wheelchair and caught Emma's sleeve, gentle but firm. Emma stopped immediately and leaned down so Lily could see her face. Lily's lips formed words without sound. "Who are you?" Emma held Lily's gaze, then glanced at Grant. It was not a request for permission. It was a calculation of consequences. Emma spoke slowly, shaping each word. "I am a nurse." Lily shook her head, frustration sharp. Her mouth moved again. "Not that." Emma exhaled quietly, then placed her hand over Lily's fingers on her sleeve, steadying them. Her voice remained soft. "I used to be something else." Lily's eyes narrowed, hungry for meaning. Grant watched the exchange and felt the room around them tighten, despite the quiet corridor. Secrets were moving now, and secrets changed how people looked at you. A pager beeped in the distance. A cart rolled past and then disappeared. The hospital breathed on. Emma straightened. "Therapy, now. Talk later." Lily's fingers tightened again, then slowly let go. They returned to the therapy suite and the work continued. Renee increased complexity carefully, never raising intensity too fast. She played rhythmic pulses that shifted mid-pattern, forcing Lily's brain to track changes. She layered faint spoken syllables under the pulses, not full words, just fragments designed to ride vibration and pattern recognition. Lily's face would tighten, eyes narrowing, lips parting as if she could taste something on the edge of memory. Some days she responded quickly. Her head would tilt, her eyes would move toward the source, her tapping would sync almost perfectly. Other days she looked exhausted, irritated, like the door had slammed shut again. On those days, Grant watched her spirit fight her body, and it terrified him more than silence ever did. Silence had made Lily calm. Progress made her desperate. In Lily's room at night, Grant tried to make home inside the sterile space. He brought her favorite hoodie. He brought a small notebook and pen so she could write when lip reading was too slow. He brought a deck of cards and taught her a quiet game they could play without words. He learned to tap the table twice before speaking so Lily would look up. He learned to wait until she was looking, truly looking, before moving his mouth. Lily wrote messages in the notebook when frustration boiled over. "I hate this. Why me? I can feel it, but I cannot catch it." Grant read every line and answered with words shaped carefully so she could see them. "I am here. We keep going. You are not alone." He did not tell her he sometimes sat in his car in the parking garage after she fell asleep and clenched the steering wheel until his hands ached. He did not tell her he wanted to punch walls when doctors spoke too confidently. He did not tell her that the only reason he stayed composed was because Lily was watching him the way she used to listen to him. One afternoon, Dr. Serrano brought Lily into the neurology suite again for updated measures. The electrodes went on, the room went still, and the patterns played through calibrated equipment. The waveform rose again, delayed but present. Dr. Serrano marked notes with quick strokes. A technician printed a strip of data and handed it over. Dr. Klein stood in the corner silent, watching like a man attending his own trial. Grant watched Lily's face instead of the screen. Lily's eyes were closed now during the tones, not because she was giving up, but because she was focusing on sensation. When the pattern stopped, her eyelids fluttered open, and she looked frustrated like something had been interrupted mid-sentence. Dr. Serrano removed her gloves. We are seeing consistent cortical engagement. This supports the suppressed processing theory. Dr. Klein's voice was low. Suppressed does not mean reversible. Dr. Serrano nodded. It means we do not declare permanent when we have evidence of function. Dr. Klein's shoulders rose and fell with a controlled breath. Grant could see the war behind his eyes, the war between expertise and humility. After the session, Dr. Serrano asked Grant to step into the hallway. Grant followed, leaving Lily with Emma and Renee. Dr. Serrano spoke quietly. Your daughter is driving this with determination. That helps. But it also increases risk. The more she wants it, the more she will push through fatigue. Grant nodded. I know. Dr. Serrano's eyes sharpened. We will need to set boundaries. Scheduled rest. Limited stimulation per day. If she crashes, she will hate us, but it will protect the process. Grant nodded again. Tell me what to do. Dr. Serrano looked down the hallway where Emma stood just outside Lily's room, hands folded as if she belonged to the wall itself. She spoke again softer. That nurse. Her observation was not luck. Grant did not answer immediately. No. Dr. Serrano's mouth tightened. I asked her where she learned that file. She deflected. Dr. Klein is pushing. Administration will push too once they realize what happened here. If her background is complicated, it will matter. Grant felt a chill run through him that had nothing to do with the hospital air. You think she's in trouble? Dr. Serrano chose her words carefully. I think she will be questioned. And sometimes the system cares more about the questions than the patient. Grant looked back through the doorway window at Lily, who was watching Emma's mouth with intense focus as Emma explained something slowly, probably about breathing or rest. Lily's eyes were steady, alive. Grant turned back to Dr. Serrano. Then we make sure they ask the right questions. That evening, Dr. Klein requested another meeting in the same conference room. Not a full panel. Just him, Grant, Dr. Serrano, and Emma. Lily stayed in her room with Renee. Grant knew Lily would have insisted on coming if she understood. He did not want her watching grown adults negotiate around her future. The conference room felt different now. The discharge papers were gone. The table held updated charts, data printouts, and the quiet pressure of reputations. Dr. Klein began without warmth. The neurology results require us to revise our conclusion. That is now documented. Grant stayed silent. Dr. Klein's eyes shifted to Emma. But there is an issue. You initiated a non-protocol stimulus test using personal equipment. That introduced variables. It also introduced liability. I need to understand where you obtained that frequency file and why you believed it was appropriate. Emma stood near the wall, not seated posture steady, because it was the quickest way to determine whether we needed to retest. Dr. Klein's voice sharpened. That is not what I asked. Dr. Serrano spoke calmly. Klein, keep it professional. The patient benefited from reevaluation. Dr. Klein's jaw flexed. Professional includes accountability. He looked at Emma again. Where did you learn battlefield auditory recovery techniques? The phrase sounded ridiculous in a hospital conference room, but no one laughed. It was too close to the truth to be funny. Emma's eyes did not flinch. I learned them in the field. Dr. Klein's patience tightened. Which field? Emma's mouth remained calm. A field where blast injuries were common. Dr. Klein's gaze flicked to Grant as if seeking alliance through shared authority. Admiral, do you understand what this implies? If a staff member is using military methods without documentation, it becomes a problem. Grant's response was steady. My problem was being told my daughter would never hear again when her brain was still responding. Dr. Klein's face tightened. We did not tell you she could not feel stimulation. We told you she could not hear. Grant leaned forward slightly. Doctor, you told me there was nothing left to treat. That was your conclusion. That was your certainty. The word certainty landed harder than an accusation. Dr. Serrano watched Dr. Klein carefully, then looked at Emma. Emma, I need you to answer one question honestly. You can keep details limited, but I need a credible explanation to protect you from administrative escalation. Emma's gaze shifted from the wall to Dr. Serrano. She held it. Then her eyes moved to Grant. Grant did not demand. He did not plead. He simply watched. Emma inhaled slowly. Afghanistan. The single word changed the air. Dr. Klein's expression froze. Dr. Serrano's eyes narrowed, absorbing. Emma continued, voice calm, mouth precise. I served as a combat medic, attached to a special operations support unit. I treated blast injuries that disrupted sensory processing without visible destruction. We used controlled frequency and rhythm to test whether someone was still reachable when standard equipment was limited. Dr. Klein stared at her. You were military. Emma nodded once. 10 years ago. Dr. Serrano's voice remained steady. That is relevant context, thank you. Dr. Klein's tone shifted, less sharp, more cautious. Why are you here? In a civilian nursing role. Emma's eyes did not change. Because I left that life. Dr. Klein looked down at the chart, then back up. And you kept a classified technique on your phone. Emma's reply was quiet. It is not classified. It is underused. It is not a cure. It is a stimulus. Dr. Serrano leaned forward. Klein, the key issue is not the phone. It is the missed timing and the assumption of permanence. We can handle policy later. The patient comes first. Grant did not speak for a moment. His throat tightened with something that was not anger. He looked at Emma. You saw something that did not make sense. Emma nodded. Yes, sir. Grant's voice lowered. And you stepped into the room anyway. Emma's mouth tightened slightly. Yes. Grant held her gaze. Thank you. Emma did not respond with a smile. She did not accept praise like she needed it. She simply nodded once, as if thanks were another formality in a room full of them. Dr. Klein cleared his throat. I will document that the stimulus test was performed prior to neurology confirmation, and that it prompted reevaluation. But I want it clear that any further stimulation must remain within protocol. Dr. Serrano nodded. Agreed. Grant stood. Then we are done here. He left the room and walked back to Lily's room with a calm that felt like steel. Emma followed a few steps behind, quiet. Dr. Serrano walked beside Grant, speaking low. You handled that well. Grant did not respond with pride. He responded with truth. I handle storms. This is harder. When they entered Lily's room, Lily was sitting upright, notebook open, pen in hand. She looked up immediately, eyes scanning faces for meaning. She saw Emma, and her gaze locked on her, demanding. Grant moved close and spoke slowly. Emma used to be a medic in the war. Lily's eyes widened. She looked at Emma, then mouthed. War. Emma nodded once. Lily's mouth formed another word. Why? Emma leaned closer and spoke slowly. So people could come back. Lily stared at her for a long moment, then reached out and took Emma's hand. Not a dramatic gesture. A steady one, an anchor. Emma did not pull away. She held it for a moment, then gently released, adjusting Lily's blanket as if returning them to safe ground. The next therapy session felt different. Not because the equipment changed, but because Lily had a new way to imagine Emma. Not a rookie. A person who had lived in places where decisions were made fast and wrong decisions killed. Lily watched Emma's mouth like it carried a second language she wanted to learn. Renee introduced another variation, a rhythmic pulse that mimicked speech cadence. Not words, the shape of words. Lily's tapping matched, then faltered, then matched again. Dr. Serrano stood nearby tracking readouts. Grant sat in the corner, still and attentive. At the end of the session, Renee layered a faint spoken prompt under the pulse, a single syllable placed carefully where vibration could help. Lily's face changed. Her brows drew together. Her eyes widened. She leaned forward and pressed her fingers against her throat, feeling her own vibration as if trying to remember how speaking felt. Renee spoke slowly. Try. Lily shook her head, frustrated. Emma stepped closer, calm, slow. Lily stared at her mouth, then inhaled deliberately. Her lips moved. Nothing came out. Her eyes flashed with anger. She clenched her fists. Grant stood stepping closer without rushing. Lily. She looked at his mouth, eyes wet. Grant spoke slowly, steady. Breathe again. Lily inhaled. Her throat tightened. Her lips trembled. A sound escaped, not a word. A breath shaped into something that was not silence. It was small, fragile, but it existed. Lily froze, eyes widening with shock. She felt it more than heard it. Grant's chest tightened, and for a second he could not move. He did not want to spook the moment with emotion. Emma watched Lily's face, then nodded slowly as if confirming the sound was real. Lily tried again. Another small sound. Then her eyes flew to Grant. Her lips formed a word before her voice could. Dad. Grant dropped to one knee, hands reaching for Lily's with a care that looked like worship. He did not speak. His mouth opened, then closed. His throat failed him. Lily's eyes flooded. She laughed, softly, startled by the sensation of her own voice, and tried again, shaping the word with fierce concentration. Dad. The room held still around them. Renee looked away for a moment, blinking hard. Dr. Serrano's face softened, then tightened back into clinical control as she stepped forward and checked Lily's vitals without interrupting the moment. Emma stepped back toward the wall, letting the family occupy the center. Her expression did not change much, but her eyes softened in a way Grant had not seen before. Not pride. Relief. Lily squeezed Grant's hands and mouthed, half laughing, half crying, "I said it." Grant nodded, tears finally breaking free. He did not care who saw them. "Yes, you did." Lily laughed again, then startled herself by the sound of its shoulders trembling. Dr. Serrano spoke softly to Renee. "Stop stimulation. Let her rest. Do not overload." Renee nodded and powered the equipment down. The silence returned, but it was no longer empty. It was occupied by something new, a memory of sound that had just proven itself possible. Grant stayed on one knee beside Lily, his forehead almost touching her hand. Lily looked at Emma, eyes intense. Again, Emma met her gaze. "Rest first." Lily's frustration flashed, then faded into exhaustion. She nodded reluctantly and leaned back in the chair, breathing hard as if she had run miles without moving. Dr. Serrano turned to Grant. "This is significant. But we protect it. We do not chase it until she collapses." Grant nodded, still kneeling. "Understood." Dr. Klein entered the therapy suite a few minutes later, drawn by the sudden stillness in the hallway. He stopped at the doorway, saw Grant kneeling, saw Lily's face, saw the dampness on Grant's cheeks. He looked at Dr. Serrano. "What happened?" Dr. Serrano's voice was quiet, controlled. She vocalized a word. Dr. Klein's face tightened as if he had been struck. Grant stood slowly, wiping his face once, and regaining posture by force. Dr. Klein stepped forward, then stopped, unsure how to exist in this new reality. Lily looked at his mouth and frowned, trying to decode his expression. Dr. Klein spoke carefully, slower than usual, so Lily could read. "You did very well." Lily stared at him, then mouthed a question. "Why you said never?" Grant watched Dr. Klein's face change. "Not much, but enough." The question landed. Dr. Klein swallowed. "I was wrong to be certain." Lily blinked hard, then looked away, exhausted, unwilling to comfort a grown man. Dr. Serrano guided Lily back toward her room, and Grant walked beside her chair. Emma followed behind, quiet. Dr. Klein lingered in the hallway for a moment, staring at the therapy room equipment as if it had betrayed him. Then he turned and walked away with the posture of someone carrying a heavy correction. In Lily's room that night, Grant sat beside her bed again. Lily's eyes stayed open longer than usual, as if she feared sleep would erase the door she had found. She lifted the notebook and wrote with shaky letters. "Did I hear?" Grant read it and answered slowly. "You felt, you responded, you spoke." Lily stared at his mouth, then wrote again. "Will it go away?" Grant's chest tightened. He chose honesty without cruelty. "We do not know. We keep working. We protect you." Lily wrote again. "Emma saved me." Grant looked at the line for a long moment, then nodded. She helped you. You did the work. Lily's eyes moved toward the door as if she wanted Emma to appear on command. A soft knock came. Emma stepped in carrying a cup of water and medication. She moved quietly, checked Lily's vitals, offered the cup. Lily drank, then held Emma's gaze and mouthed, "Thank you." Emma paused, then nodded once, accepting the gratitude without ceremony. Lily's lips moved again. Afghanistan. Emma's eyes flickered with something old. She nodded. Lily mouthed, "Scary." Emma's mouth tightened slightly, then she spoke slowly, careful. "Yes." Lily stared at her, then mouthed, "You miss." Emma's gaze lowered for a moment, then returned. "Some parts." Lily reached out and touched Emma's sleeve again, gentler now. Emma leaned in. Lily's lips formed words with fierce effort, the way she had forced sound earlier. "Help me." Emma nodded. "Tomorrow." Then Emma looked at Grant. "Keep her rested tonight." She pushed hard. Grant nodded. "I will." Emma turned toward the door. Grant spoke quietly. "Emma." She paused, looked back. Grant's voice stayed steady. "You did not have to step into that room." Emma's gaze held his. "I saw something that did not make sense." Grant nodded slowly, understanding the kind of person who could not ignore that feeling. Emma left. Grant sat beside Lily until her eyes finally closed. Even then, her fingers moved faintly on the sheet, tapping a slow rhythm as if guarding the door from the inside. Outside, the hospital continued. Footsteps, carts, voices Lily could not hear. But inside that room, sound had become a possibility again, fragile and real. And every person in that building who had called the case finished would have to live with the fact that it had not been finished at all. Morning came in gray layers, the kind of coastal winter light that made everything look honest. The rain had stopped, but the air still held the damp chill of Norfolk. Grant stood at the window of Lily's room, watching the parking lot below fill with staff arriving for shift change. He kept his hands behind his back out of habit, but the posture felt less like command now and more like restraint. He was restraining emotion, restraining urgency, restraining the instinct to force outcomes. Behind him, Lily sat up in bed with her notebook open. Her hair was pulled back, her face pale from the previous day's effort, eyes bright and impatient. She kept touching her throat with her fingertips as if the memory of her own voice was a fragile thing she needed to confirm. Emma entered quietly with Renee and a tech carrying a small cart. Emma's eyes swept Lily's face, once looking for strain. Lily's gaze snapped to Emma immediately. Emma spoke slowly, mouth clear. "How are you?" Lily hesitated, then mouthed, "Tired. Good." Emma nodded. "Good tired is okay. Bad tired is not." Lily frowned, then nodded as if she understood the boundary, even though she hated it. Dr. Serrano arrived minutes later with a folder tucked under her arm. She greeted Grant with a nod, then moved to Lily's bedside and spoke with deliberate clarity. "Today we test, and then we do therapy. Small doses." Lily stared at her lips and nodded hard. Dr. Klein appeared in the doorway a moment after that, as if he had been waiting outside until he was certain he would not interrupt something intimate. He stepped in with his folder held tight against his chest. His posture was careful, more cautious than the man who had slid discharge papers across a table days earlier. Grant turned. "Doctor." Dr. Klein nodded. "Admiral." He looked at Lily, then spoke slower than usual so she could read. "Good morning, Lily." Lily watched his mouth for a long moment. Then she lifted her notebook and wrote a single line, hard strokes. "Do not say never." She held it up so he could see. Dr. Klein's eyes flickered. His mouth tightened. He nodded once, slow. "I will not." Dr. Serrano redirected the room. "Neurology first." They moved Lily through the hallways again, but the hospital no longer treated the movement as routine. Staff glanced up when the wheelchair passed. Conversations lowered. Charts were reread. People who had not cared the week before now cared in the way professionals care when they realize they might have been wrong. In the neurology suite, Lily sat under the electrode cap once more. The gel was cold. The room was still. The monitor line waited. Dr. Serrano spoke to the technician. "Baseline first." Then stimulus, random intervals. The technician nodded. The line steadied. The first tone played. The waveform rose with a clarity it had not shown on day 1. Still delayed, but cleaner, less buried in noise. Dr. Serrano marked a note without looking away. Another tone, another rise. Then a rhythmic pattern. Lily's shoulders tensed, then released slightly. Her breathing aligned with the pulse. Her fingers resting on her lap began tapping in time. Dr. Serrano held up her hand. Stop. She leaned toward Lily and spoke slowly. You are doing well. Keep breathing. Lily nodded, eyes closed now, face concentrated. Dr. Serrano turned to Grant. The responses are strengthening. That suggests the suppression is lifting at least partially. Grant nodded once, careful not to let relief turn into speed. Dr. Serrano continued. This does not guarantee full hearing, but it supports a rehabilitation plan, not just adaptation. Grant absorbed the words. Rehabilitation, plan, not hope, not miracle. A structured path. Dr. Klein stood silent near the back, watching the waveform, watching evidence form in real time. He did not speak. That silence was its own admission. After testing, Lily was wheeled back to the therapy suite. Renee prepared the equipment. The patterns began again, gentle and structured. Lily matched the rhythm faster now. The tapping on her fingers became steadier, as if her brain had found traction. Renee introduced faint-spoken syllables again, layered carefully under the pulses. Lily's face changed. Her brows drew together. Her lips parted. Her throat moved as she swallowed. Grant leaned forward, instinctive. Emma held up a hand, palm down, a quiet signal to keep still. Grant obeyed. Lily tried to form sound again, not forcing, just testing. A breathy vowel slipped out, barely audible. Lily froze. Her eyes widened. She touched her throat again, as if the sound came from someone else. Renee spoke slowly. That is good. Rest. Lily shook her head, frustration flaring. Emma leaned closer and spoke with precision. One more. Then stop. Lily stared at her mouth, then nodded grudgingly, accepting the rule. Lily inhaled. Her lips trembled. Dad. The word came softer than yesterday, but cleaner. Grant's chest tightened. He did not drop to his knee this time. He remained still because he understood now that calm protected the process. He reached out and took Lily's hand. Lily squeezed back, tears spilling without sound. Emma watched Lily's face and then nodded to Renee. Stop. Renee shut down the stimulation. The room quieted. Lily leaned back exhausted, but her eyes stayed alive. Grant spoke slowly so she could read. That was you. Lily nodded, smiling through tears. Dr. Serrano checked Lily's vitals, then spoke to the team. This is enough for today. The staff began disconnecting equipment, documenting results, updating charts. Dr. Serrano dictated clinical notes out loud, for the record voice steady. Patient demonstrates repeatable auditory processing response inconsistent with declared permanent deafness. Vocalization improving under controlled stimulation. Continue protocol with caution. The words sounded like bureaucracy, but to Grant they sounded like a door being unlocked by official hands. In the afternoon, administration called for a formal case review. It was not presented as punishment, but the tension in the request was unmistakable. Hospitals did not like contradictions. Contradictions meant paper trails, and paper trails meant scrutiny. Dr. Serrano insisted the review occur with Lily's interests protected. Grant insisted on being present. Dr. Klein insisted on being prepared. They convened in a larger conference room this time. A hospital administrator in a suit sat at the head of the table, flanked by risk management and a nursing supervisor. The room smelled like coffee and printer paper. Grant sat in full uniform again, not as intimidation, as armor. He kept his hands clasped, posture controlled. Emma sat near the end of the table, still and quiet, her badge and scrubs suddenly feeling too thin for the weight of the room. Dr. Serrano presented first. She laid out the objective findings: waveforms, timing, repeatability. She spoke of suppressed processing trauma-induced gating and the changes observed under controlled stimulation. She used language that made it hard to argue without sounding like denial. Then the administrator turned to Dr. Klein. "Doctor, your department's initial conclusion was permanent loss. Explain the discrepancy." Dr. Klein's throat moved as he swallowed. He looked at the data on the screen, then at Grant, then down at the table. When he spoke, his voice was quieter than the man who had dismissed Emma at the door. "Our conclusion was based heavily on early testing and imaging. In hindsight, acute inflammation and sedation may have suppressed responses more than we accounted for. We did not schedule adequate frequency-based retesting after stabilization." The words were careful. They were still an admission. The administrator's gaze shifted to the nursing supervisor. Nurse Shaw initiated a stimulus test using personal equipment. "That is a policy issue." Emma did not flinch. She kept her hands-folded posture steady. The supervisor looked at Emma. "Explain your decision." Emma spoke with calm clarity. "I saw a mismatch between the finality of the conclusion and the patient's micro-responses. I requested permission to run one low-intensity stimulus test. The goal was not treatment. The goal was to determine whether further evaluation was warranted." Risk management leaned forward. "Where did you obtain the stimulus?" Emma looked at Dr. Serrano, then at the administrator. "From prior training." The administrator's eyes narrowed. "Specify." Emma's pause was brief, controlled. "I served as a combat medic, special operations support. We used controlled frequencies to check reachability after blast injuries." The room went still, as if everyone suddenly realized they were no longer discussing a normal nurse. The administrator's expression remained professional. "Is that training documented in your file?" Emma answered honestly. "No." The nursing supervisor's lips tightened. "Then why were you hired as a rookie nurse?" Emma's voice stayed even. "Because I completed civilian nursing requirements. I did not apply as a veteran medic. I applied as a nurse." The administrator tapped a pen against the table, thinking. Grant spoke for the first time, voice low. "My daughter was sent home as a closed case. She was told to adapt to permanent silence. Nurse Shaw asked for a retest. Neurology confirmed the diagnosis was incomplete. If you want to discuss policy, do it. But do not treat the person who reopened the right question as the problem." Risk management tried to soften the tone. "Admiral, we are not blaming her. We are ensuring compliance." Grant's reply was steady. "Compliance should not be more important than correctness." Dr. Serrano backed him without raising her voice. "We can address policy by formalizing additional training, supervision, and documentation. But the clinical outcome supports the decision to retest. The patient benefits. That is the priority." The administrator held up a hand, stopping the drift into argument. "We will implement a revised protocol. Any determination of permanent auditory loss must include retesting after stabilization documented in the chart. We will also create a pathway for staff with military medical training to disclose relevant skills appropriately within policy." He looked at Emma. "Nurse Shaw, you will meet with nursing leadership to document your background and receive authorization for any specialized approaches. Under supervision." Emma nodded once. "Yes, sir." He looked at Dr. Klein. "Doctor, your department will participate in the protocol revision." Dr. Klein nodded, jaw tight. "Understood." The administrator looked at Grant. "Admiral, we apologize for the distress caused by premature finality. We will support Lily's rehabilitation plan." Grant did not accept the apology with gratitude. He accepted it with restraint. "Thank you." The meeting ended with signatures and forms, but this time, signatures did not close doors. They opened them. Back in Lily's room, Grant sat beside her bed. Lily watched his face, carefully reading that something heavy had happened. Grant spoke slowly. "They will keep helping." They changed the plan. Lily's eyes narrowed. "Emma, trouble." Grant hesitated. Lily was smarter than the adults around her gave her credit for. "Not trouble. Questions. But she is safe." Lily looked toward the door, impatient. "Emma." Emma entered a moment later, as if Lily's need pulled her in. Emma carried a folder, now paperwork, from nursing leadership. She looked tired, but her posture remained steady. Lily stared at her mouth, then lifted her notebook and wrote quickly. Are you leaving? Emma read it and shook her head. No. Lily wrote again. Promise. Emma looked at the page, then at Lily. I do not promise what I cannot control. Lily's face tightened, anger flickering. Emma leaned closer and spoke slowly. I will be here while you are here. Lily's eyes softened slightly. She nodded once, accepting the boundary because it was honest. Grant watched Emma and felt the strange weight of gratitude mixed with discomfort. He owed her. He also understood that owing was complicated. Emma glanced at Grant. They want documentation. Meetings. They want my history on paper. Grant nodded. That is what institutions do. Emma's mouth tightened. Paper does not capture why you notice something. Grant studied her. Why did you notice? Emma's eyes shifted to Lily, then back. Because I have seen what happens when people get labeled unreachable. Grant felt the words in his chest. Unreachable. Not deaf. Not broken. Unreachable. Lily watched Emma's mouth and then mouthed, carefully forcing sound as best she could. Able. The syllables were soft and imperfect, but they existed. Emma's eyes softened, and she nodded. Yes. In the days that followed, Lily's discharge plan took shape. Not the old plan that assumed permanent silence, but a plan built on cautious progress. A schedule of therapy sessions. Neurology follow-ups. Audiology retesting. Speech therapy. Physical rehab for her legs. No one used the word miracle. They used the word protocol, and for once it meant persistence rather than surrender. On the morning of discharge, Lily sat in her wheelchair wearing her red hoodie again, hair brushed back, notebook in her lap. She looked exhausted and alive. Grant stood behind her chair in uniform jacket, buttoned, posture steady. Dr. Serrano reviewed the plan with Grant, slowly ensuring Lily could read her mouth as well. We continue stimulation at home with approved devices. We do not improvise. We track fatigue. We return weekly for assessment. Grant nodded. Understood. Dr. Klein arrived with a folder and a different expression than the one he had worn on day one. He looked at Lily and spoke carefully, slow mouth movements. Lily, I owe you an apology. Lily watched his mouth without blinking. Dr. Klein continued. I was wrong to speak with finality. I should have tested again. I am sorry. Lily stared at him for a long moment. Then she lifted her notebook and wrote a line slower this time. Do better. She held it up. Dr. Klein nodded once, swallowing. I will. He turned to Grant. Admiral, I am sorry. Grant met his eyes. Then be the kind of doctor who checks twice. Dr. Klein nodded and stepped back, letting the moment end without theatrics. Emma stood near the doorway, packing supplies, trying to disappear into her role again. She moved quietly, avoiding the spotlight. But Lily's eyes kept finding her. As the final paperwork was signed, Lily lifted her hand slowly. Her fingers were still weak from therapy and stress, but the movement was deliberate. She raised it in a small salute toward Emma. Emma froze for a half-second. Then she returned a nod, small and controlled, acknowledging without making it ceremonial. Grant watched the exchange and felt something tighten in his throat again. He stepped toward Emma, lowering his voice so only she could hear. You changed our trajectory. Emma shook her head slightly. Your daughter did. Grant held her gaze. You refused to accept easy certainty. Emma's eyes were steady. I refused to ignore a mismatch. Grant nodded slowly, as if committing the phrase to memory. Mismatch. Emma adjusted her badge on her chest, a small gesture that looked like resetting armor. Grant spoke again. If you ever need an advocate in this institution, you have one. Emma's mouth tightened, not with emotion but with understanding. Thank you, sir. Lily looked between them, reading the tone without hearing it. She mouthed to Grant, careful and determined. Go home. Grant smiled small. Yes. They rolled Lily down the corridor. The hospital doors opened to cold air and pale sunlight. Outside, traffic moved as if nothing had happened. People carried coffee. Cars honked. A distant siren wailed somewhere across the city, unheard by Lily but visible in the way heads turned. Grant helped Lily into the car with slow care. He positioned her seatbelt. He adjusted her braces. He leaned close and spoke so she could read him. "We will keep working." Lily nodded, then touched her throat and mouthed, "Dad." The word came out soft but audible enough that Grant heard it without straining. It hit him like a wave. He closed his eyes for a fraction of a second, then opened them and smiled at her in a way that did not need sound. Emma stood at the hospital entrance watching them leave. She kept her posture neutral, hands folded, blending into the line of staff coming and going. Another nurse, another shift. But Grant knew better now. As he drove away, he glanced at Lily. She stared out the window, fingers tapping faintly on her leg, matching a rhythm only she could feel. Then she turned toward him and said, breathy but real, "Dad." Grant nodded, voice steady, despite the break in it. "I am here." Behind them, the hospital returned to routine, but a protocol had been rewritten. A conclusion had been reopened, and a girl who had been labeled lost to sound was no longer treated as a finished story.